So I am working on a project that is related to getting access to birth medications for out-of-hospital birth at home or in birth centers. And one of the long-standing issues that we have had is that pharmacies are not supplying these medications reliably. So I contacted the Virginia Association of Pharmacy and asked for their help, as well as the Virginia Neonatal Perinatal Collaborative, and through our efforts together, along with the Birth Center Association for Virginia, with Misty Ward, we've come up with an idea of creating pharmacy hubs throughout Virginia. So what this would look like is with input from all of the midwives that we can get to give us some data, we can anticipate how much supply of medications that we would need to arrange for through pharmacy hubs throughout Virginia. So I'm thinking we would have maybe 5 or so pharmacies, and they're kind of recommending that compounding pharmacies would be a good option, just because many of those pharmacies are used to creating packages of medications and mailing those out. So we do not have to depend on a local pharmacy where your client would go and pick up the prescription medication, the neighboring CVS. It would actually be, for many of them, it would be, we send the prescriptions to one of these hubs, and they will be very well versed in knowing what medications that we are prescribing and making sure that we have adequate supply, because some of these medications, such as vitamin K or Rofalac, you have to buy in larger packages, and very few pharmacies want to supply something that's going to cost them several hundreds of dollars to give one of these medications to a mom, and then they have to they don't get reimbursed for the remainder of the cost, so they lose several $100s. So it makes sense to make these hubs. So that is why we're sending out this form, and it is not to try to fish for information for any kind of nefarious reasons. It's purely so that we can set up these hubs and be able to advise each of these pharmacies approximately how much supply that they need to have for their region, and we want to be able to train each one of these pharmacies to know what to expect, and that just there's lots of idiosyncrasies, as well as some of the medications are not covered under pharmacy plans, but they're covered under medical plans. And if the prescribing providers, such as myself and other nurse midwives or physicians, if we can get together and do a little bit of training to know, okay, we're going to be sending our prescriptions off to these certain regional hubs to be processed, and then either mailed to the client straight away, or if the client is nearby that hub, then of course they can go pick it up. That would make it a whole lot easier. So again, I just, I've put several questions together. I just ask you to answer to the best of your ability. If nothing is required for the questions can be answered or not. It's purely voluntary. It's nothing. None of them are required. I'm not tracking, who is responding, because I know that some people are uncomfortable with providing their personal information, and I want to respect that. But this is ultimately, I see this as serving the moms and the families, and so I hope that you will be willing to participate and even just share. If you don't use medications at all, and that's not your thing, that's fine too. It's nice to even know if that's the case. So I hope that you'll consider, and there's a place that you can put your comments or questions, because I'm sure I haven't thought of plenty of things that maybe you have, or common issues that you come across. So just really appreciate your input. And again, I do respect anonymity, and I will not be tracking who says what unless you provide that information to me. Okay, thank you very much.